At some point, a family is going to hear that their loved one has to want help, they have to ask for help, or they have to hit bottom before anything that can change. And now there is truth to that. But we always have to remember that if somebody is not asking for help, isn't wanting help, or isn't feeling a bottom, it's because they believe that their current situation is a better option than addressing it. When we look at that second stage of change, where the person has to acquire something called ambivalence, meaning they have to be able to see two sides of the argument, that is the make or break moment for somebody with substance use or mental health, where they either stay the same or they move on. And what families often look at, or often fail to look at, is when somebody makes that comment, is there anything that they're doing to prevent wanting help, asking for help, or hitting bottom from occurring? And we have never met a family that wasn't doing something. Some families are doing it at a grand scale, some on a minimal scale, some simply by taking no action at all are making the person's life just comfortable enough to where they don't have to do something different. And remember this, guys, bottom is not something you hit. It is something that you feel. So many people believe bottom is loss of finances, car, spouse, home, etc. But bottom is truly when the person gets to that place where they can't go on anymore emotionally, when they feel that they just can't live in their own skin anymore because of the way they feel about themselves. And that's when they know that they have to do something different. So when somebody says they have to hit bottom, the question that should be considered is, well, why are they not getting there? You know, a lot of times we hear you could lead a horse to water, but you can't make it drink, and that's not true. If you enclose the horse in a large fenced-in area and leave it a drinking trough, what's required is patience and boundaries, because when the horse's survival instincts kick in, it will eventually drink. Now, how that can go sideways is if somebody steps in and opens the gate. And that's what can happen with a dysfunctional family system. When somebody's nearing their bottom and then takes the route of survival, there are family members who can't take it before that happens. They go what we would call as rogue, and that person is denied the help that they need. So families must understand that you must feel bottom. And there is a large part that families play as to whether or not the substance user is going to get there. And on our website, underneath the resources section, if you sign up for our webinars, I have a whole 1-hour topic on this with a Q&A section, so you can learn more about what it takes to get to the bottom, why people aren't getting there, and how families can impact or influence somebody wanting help or asking for help by bringing the bottom to them on their terms, rather than waiting for their loved one to arrive at a bottom that may be severely damaging on society's terms.